the organizations here present, united as a coalition, working towards improved social service delivery in Harare Metropolitan Province, gravely concerned by the sudden outbreak of cholera and typhoid in Glenview, Area 3 and 8, that have been mainly affected by this cholera outbreak and typhoid. Mainly the areas are Crescent 71, 72, 73, 74, 75, 76, and also in Glenview South, Area 1 and 2, Crescent 54, 55, 56, and 57, as well as in First Drive. In Glenview, which has had a spite of unattended to sewer bursts, and Budiriro area 1, which has numerous shallow and unprotected wells where residents are accessing water. Outraged by the needless loss of lives of 5 residents in the said area, as well as more than 40 confirmed cases of typhoid as of yesterday, the 6th of September 2018. Acknowledging our inalienable right to life, to clean water, to health, and a clean environment as provided for in the new Zimbabwean Constitution. Maintaining that incessant erratic water supplies as well as an intransigent city bureaucracy that fails to act swiftly to sewer bursts remains the single most contributor to the current and past outbreaks of cholera and typhoid outbreaks. Worried, the city of Harare, through its district office in Glenview, was informed and requested to act on the sewer bursts, but did not act, citing fuel shortages. Following reports from our community activists and leaders in the last 2 weeks, we have been engaging the Glenview district office to attend to sewer bursts in the area around 71 and 72 Crescent. This follows our everyday engagements with the city of Harare on the need for consistent, clean water supplies to all residents in Harare. We are disappointed that the city ignored these calls for action, citing absurd reasons that they do not have fuel. What is most worrying is that the January to July city income and expenditure statements reflects an over 70% expenditure on salaries and administration, and yet the city fails to attend to simple problems like sewer bursts. We contend that these sewer bursts and the attendant water problems are at the heart of the outbreaks, as opposed to the usual accusations that vendors cause cholera, typhoid outbreaks. The water supply situation in Harare remains dire. The city is practically providing water that actually reaches consumers about a quarter of about 20 megaliters of water a day, against a daily demand of over 800 megaliters. There seems to be no clear plan to address this issue, and we implore the new mayor of Harare, Councillor Herbert Gomba, to ensure that water provision is at the heart of his new term of office. We implore the mayor to ensure that the water account is ring-fenced. Water services remain the cash cow of the city, and yet it is the service that continues to suffer under the guise that residents are not paying bills and expanded wage bill. We also implore the government to resuscitate the public sector investment program that will provide resources to rehabilitate the dilapidated water infrastructure. We thus make the following demands. Number 1, that the Ministry of Health declares a health disaster in Harare and acts swiftly to contain the situation in Glenview and Budiriro. Number 2, the city of Harare must urgently, without any further delay, provide consistent supply of water and potable water, even if it means through water bowsers, especially in the affected areas, to contain the spread of the diseases. to attend to sewer bursts and ensure the burst pipes and blockages are replaced, to ascertain the sources of the outbreak, as some boreholes are suspected to be contaminated, to engage the residents' associations, community advocacy groups, and the local community on an urgent conscientizing program and raise awareness on cholera and typhoid. To sanction the Glenview district officer, we ignored a health situation and demonstrated gross negligence that has led to loss of life. As the rain season approaches, the city of Harare and Chitungwiza must realize their state of preparedness plans to contain the disease outbreaks that normally accompany the rains. It cannot be that every year people lose life due to outbreaks. To develop a plan to manage its staff costs that continue to gobble over half of the city's budget. We call upon the Zimbabwe Human Rights Commission to investigate this flagrant violation of our fundamental right to health, to life, and clean water, and ensure that there is substantial compliance by the city. If at all, the city of Harare must help respond for this needless loss of life. And that the 2018 to 19 city budget must make water provision a priority. Further, we implore the Ministry of Finance to ensure that its 2018 budget, there are substantial provisions for rehabilitation of liquid waste as well as water provision for local authorities as envisaged under the devolution. The city of Harare, the Ministry of Health, local government must assist the families that have lost their members in every way possible. This is the end.